Absolutely. My name is Mikhail Scott. I serve as the Director of Government and Corporate Relations for Indelible Solutions. We're also the sponsors of the Vax305 initiative.
All right, let's get started. Hey, it's 1035 The Beat Mommies, do that one for hip hop, R&B, and the Breakfast Club. Papa Keith here with Mikhail Scott. What's good, my brother?
What's going on, Papa Keith? Great to be here today.
Yeah, good vibes, man. We met a while ago down at a turkey drive.
Yeah, man. It's probably about 3 years ago now, right?
Yeah.
Giving back to the community for a while.
I'm telling you, I think at the time you were working with State Rep McGee, and now he's a commissioner.
Correct. I was working with the House Minority Leader. He was a minority leader at the time, and now he's serving District 9. Man, he's still doing some amazing things down there. But it's just great to be back in the Miami-Dade community, working to bring awareness to another really important issue. Food access is one of them back then, but there's a lot of other things going on right now that we want the people to be aware of, and we're hoping that we're the best voice to do that. And working with folks like you all has been making it even more impactful.
So you have a company called Indelible, right?
Correct. So Indelible, we're actually a management consulting firm. We're also a minority-owned firm. So our C-suite is all African-American. Our founders, FAMU graduates. I'm also a FAMU graduate myself. And we focus specifically on, like emergency management. So we work with the Division of Emergency Management here in Florida, as well as the Department of Health and a lot of other state agencies, particularly around creating governmental initiatives and helping communities that are underserved or have barriers to access. So we've been doing this for about 3 years now. And more recently, we were brought in to work on the COVID-19 response, not only with COVID-19 vaccinations, but also emergency rental assistance for people that have been hit hard.
Yes, before we get into that, Vax305 and all that good stuff, I want a little bit more background on you because I find, you and your story to be a bit intriguing. So how did you get involved, because like I said, we did meet a few years ago, but how did you get involved with this stuff?
Absolutely. So I graduated from FAMU, man. I'm a FAMU Rattler. 2013, I started my degree in public service. So I started working for the Florida Department of Agriculture. And since then, I've been working anywhere between politics, state government, and pretty much community relations and community development. Because I understand, man, that a lot of times our communities don't have access because we don't have a voice. We don't have access because we don't have the information. And so I've been able to, throughout my career, work with a lot of elected officials, community leaders in both the business and nonprofit realm to try to find ways to reach our community. And the more recent initiative with the vaccine management has been one of them. But, we really try to look to it from an overall public health perspective.
That's really dope. And thanks for sharing that, because I like people to get to know a little bit about who I'm speaking with as well, differently from the company or the initiative,
Right.
So we have reconnected with this Vax305 initiative. Can you explain what Vax305 is all about to my audience?
Absolutely. So Vax305 is actually a public health awareness initiative that's in partnership with the Florida Division of Emergency Management and the Florida Department of Health and Indelible Solutions. So we've been working with the state, like I said, around a lot of emergency management situations, and particularly with Vax305. We know that the vaccine has been out for a while, and unfortunately, there's still a lot of misinformation out there about what the vaccine may do to folks that take it. There's also a lot of hesitancy in the African-American and other communities of color. And so, a lot of people are in this point where they're waiting, they have questions that they need asked or that they want to ask that they need answered. And so our initiative is really here to work with community partners like yourself, working with organizations like the Miami-Dade Chamber of Commerce, Miami South Chamber of Commerce, breaking the cycle, local elected officials like Mayor Cava, really just to try to bring everybody that we can to the table to amplify the message, because, COVID really did a number on us last year. And unfortunately, sometimes I think not just as our communities of color, but people in general have short-term memory loss. Our state was shut down, our communities were shut down, people were out of jobs, people were dying. And now it's like we haven't really hit that state of normalcy yet because we haven't reached herd immunity. And the COVID-19 vaccine is a safe way for us to make sure that we can do that and try to get past this pandemic.
So what kind of services does Vax305 offer? We know information is one of them that you just mentioned, kind of informing people, about some myths and some fact checks on vaccines. But do you actually offer the vaccine itself?
Correct, correct. So we actually do have a medical team. Our medical team is led by Dr. Bruce James, who is also a FAMU graduate, and as
He's the
well
one
as
I met the other day, right?
correct, correct. He's
Yeah.
also a Tuskegee graduate as well. So
Right.
Dr. James and his medical team, they facilitate a lot of things for like our call center with any questions for people that want to speak to a doctor. We've got licensed RNs, EMTs, nurse practitioners that are fielding these calls and also helping people to know where they can actually go to get vaccinated. Our team has also been involved with pop-up vaccinations as well. So one of the things that we find to be more helpful is if you meet people where they are, and if you find those trusted voices in the community that are able to relay this message in a way that it's accepted and people know that it's truthful, that it's not any type of pushy type of situation, we'll be able to do those pop-ups at events as well. And we plan to do some of those pop-up events here in Miami-Dade County in the upcoming weeks as we start to develop a little bit more of these relationships with some of the bigger events that are happening around the city.
Yes, talking about that, you will be joining myself, 1035 The Beat, for a Juneteenth celebration down in the Southwest at Richmond Heights, and we do plan on offering the vaccine live there as well.
Correct.
Do people have a choice with Vax305? Is there a choice of vaccines, or do you what vaccine do you guys focus in on?
So yeah, so there is a choice. So we work with a lot of different partners. Since we're in partnership with the Department of Health, right? We have access to a few of the different vaccines that are now available. Johnson & Johnson is one of them. We all know that that's a one-shot vaccine, so you actually don't have to come back and take that second shot 21 or 28 days later, like Pfizer and Moderna. So that is one of the ones that we offer, as well as the Pfizer vaccine, where, as I mentioned, after that first 21 days, you've got around 21 to 43 days before you want to go back to make sure you get that second shot. And so that puts you to more of that 95, 96% efficacy to make sure that you are less likely to contract the virus. But if you do contract it, right, because it's not 100% foolproof and not many things are, what it was meant to do was to make sure that people that even if they did get the virus, that you have a much lower likelihood of having any type of severe symptoms and a much, much, much lower risk of actually dying. And death has been a big problem. And I know, we hate to talk morbid, especially in the Black community, but COVID actually impacted us the most. We had, highest percentage of deaths, highest percentage of actual contact and actually getting the virus itself. So, we have to be mindful of these things as we hear and see these resources available for us, because one thing is they won't always be there.
Yes, that's a fact. Well, listen, this is great. For people who are listening right now and they're up in the air and they have questions and stuff like that, can you give the website and a phone number that they can call at this time?
Absolutely. So if anybody has any questions out there, and if they want to learn more about what we're doing, they can go over to vax305.com, and that's VAX305.com. And on there, you can actually get a lot of up-to-date information. We've got questions and answers, frequently asked questions. We also have a vaccine finder. So if someone's like, hey, you know what, today's the day, I just need to stop putting this off, you can actually visit the website and see where the closest vaccination site is to you. And if folks want to actually go to Vax Florida, which is another outlet where we actually showcase, because we've been doing this not only here in South Florida, but also in Duval County and in the state of Virginia. If they go to Vax Florida, that's VAX Florida FL. .org, they'll be able to see some of the events that we have coming up, some of those with you, as well as some of these other sites where we'll be doing some vaccinations and also getting people the information that they need.
I must say, I'm not sure who's the head of all of this, who put all of us together. I know it's kind of like links and links and links, like this one calls this one, calls this one, calls that one. But I must say, over the years of doing community events and stuff like that, I've never been more excited in the direction of how this went, just seeing so many Black people actually come together to do things for other Black people. You know what I mean?
Absolutely.
And knowing the right things and getting the right people involved. So this has been a pretty exciting ride working with Vax305, Indelible. Shout out to Devenia and others, who've been involved with this process. And I'm very proud of all of you. And honored to work with you, because I feel like a lot of times, and this is no disrespect to anybody, but a lot of times I don't feel right about the situations, or it has a layer of corniness to it based on something somebody else wants. And with this movement, I just feel like it's just the right players doing the right thing, and everybody's trusting each other to deliver on certain promises, and it's just coming across so well. So it's just really good, and I just want to take the opportunity to give you your gold roses in that, and just even seeing you at the different events and coming out and just us vibing and talking, man. It just feels really good, and I'm very proud of you and your team, and excited about the possibilities coming out of this.
Yeah, man, Papa Keith, listen, man, it's been great. Like I said, our relationship started a few years ago, and to have that full circle moment, and to also continue to see you doing the great work that you do in the community. And I know a lot of times when it comes down to equity, right? We want to talk about equity in the Black community, and a lot of folks are asking, well, why are they pushing the vaccine on us so much? Like, why are they trying to force people to take this vaccine? Well, number one, Vax305 and Indelible, we're not here to force anybody. Right. We want to make sure people understand, though, the negative consequences that can come from not protecting yourself, as well as understanding that a lot of the information that you're receiving, if it's on these blogs and social media, if it's not coming from science-backed sources, it's really easy for you to be on that slippery slope where you're getting information that's not correct. And also, by no means is this vaccine a silver bullet to take our communities out of the disenfranchisement that we faced in the past, right? There's still a lot of equity that needs to be put into our communities. We still have to have a focus on overall health and wellness as a whole, because that's one of the main reasons why our people have been affected by the pandemic so much, because of these underlying health conditions. And so we're working with community partners to make sure that when we come out, we're not just providing access and information to the vaccine, but we want to work with healthcare providers. We want to work with telehealth. We want to work with, folks that provide insurance at lower rates so that people can actually not only go and get a vaccine once, but go and get monthly checkups or get that annual checkup, and encourage people to not just sit around and not prioritize your health, because that is an issue in our community. And it takes people that look like us to relay that message. So, we're not here for, for any misinformation. We're not here to be, it's not a hoax. We just want people to be protected. And we're going to give you all the tools and information that you need. And any folks that are out there that are interested in working with us, that want to learn more about what we're doing, definitely go over to Vax305, and I'll even say, connect them with me directly. You know what I mean, Papa Keith? We're out here, hands on the ground, boots on the ground, like you say. You see me at the event, so we want to make sure that we're here to help, and in any way that we can, we will.
That's what's up, man. Hey, listen, thank you so much for your time, the information, absolutely, for the partnerships. Big shout out to Indelible and all that you're doing, Michael. And I'm just Michael, excuse me, and I'm proud of you, man.
Appreciate that, brother. I'm proud of y'all too, man. And I'm proud of what you're doing. And I look forward to us continuing these relationships and helping our people, man, because at the end of the day, that's really what it's all about.
Big facts, man. All right, so I'll see you Saturday, hopefully. I know you're going to have a lot going on. You're going to be running around like crazy on Saturday.
I will. I'm looking forward to it, though.
Likewise, my brother.
Have a good one.
You too.